My name's Larry Allen. I'm a cardiologist at the University of Colorado. I'm also the chair of the Heart Failure and Transplantation Committee of the Clinical Cardiology Council at the American Heart Association. Our committee sponsored a new scientific statement that's coming out now entitled Evaluation and Management of Right-Sided Heart Failure. I have the pleasure today of being with two of the writers on the committee, Marv Konstam and Mike Kiernan, who are good friends and spend their time at Tufts Medical Center. Let me start with Marv first. Let us know, there are lots of statements out there. Why did you decide that there was a statement needed here, and why should our viewers pick this up and read it in detail?
Well, thanks so much, Larry. I think Michael and I and our colleagues really felt that this was a statement and a compendium of information that's time had come, that was really necessary in view of major advances that have occurred in our thinking and our ability to manage patients over the past decade and more, that really had to be brought out in a concise form to both the academic community and, importantly, the clinical community charged with managing patients with heart failure, and specifically right heart failure. I'd categorize those advances sort of into three. The first, I would say, is conceptual. I think we've really honed in on things like distinguishing left heart failure from pulmonary vascular disease, from primary right ventricular disease as key drivers in a particular patient's condition that must be distinguished. Secondly, the importance of ventricular interdependence and its role in limiting forward failure or forward output, and also the importance of systemic congestion in driving systemic organ dysfunction. The second broad area is diagnostics. You know, we've made such advances, particularly in imaging modalities, such as three-dimensional echocardiography and MRI, that have really improved our understanding of right ventricular anatomy, function, physiology, and its relationship to disease states and therapeutics. And finally, in the therapeutic area, major advances in pharmaceuticals that impact the pulmonary vasculature, and also major advances in advanced therapies and device therapy that have enabled us to save patients who really would otherwise have succumbed. So, you know, I'd love Michael to kind of expand on those thoughts and add his own.
Thanks, Marvin and Larry. I think it's become increasingly recognized that right ventricular dysfunction is a key determinant of outcomes across a wide array of different disease states, including valvular heart disease, congenital heart disease, and different cardiomyopathies. And that's really highlighted with the expertise across the writing group that includes cardiac surgeons, specialists in pulmonary hypertension, pediatric physicians specializing in congenital heart disease, as well as others in adult congenital heart disease. One of the key messages, I think, of the statement is as it relates to managing congestion in patients with right heart failure. There's this persistent misconception in the community regarding the volume-dependent state of right heart failure. And I think we do a good job dispelling some of the myths as it relates to how to best focus on decongesting patients to avoid the sequelae of things like cardiopatic and cardiorenal dysfunction. Importantly, as Dr. Konstam highlighted, there's been a lot of progress as it relates to developing novel therapeutics targeting pulmonary vascular disease with the goal of afterload reducing the right ventricle. And there's a lot of confusion in the community when thinking about which drug and which patient condition. So we highlight a lot of those areas of uncertainty. And then finally, also, as Dr. Konstam highlighted, there's been tremendous progress as it relates to developing acute circulatory support technologies for salvaging patients really with cardiogenic shock with biventricular involvement. And again, we do a really thorough job targeting not just patient selection, but device selection for this really complex and growing patient population.
Well, thanks to both of you for a great summary of the paper. I would encourage all of you to log on to heart.org. Go to the guidelines and statements section of the American Heart Association website, pull up the paper and dig in. There's a great overview, a lot of detail, And I think this is an area that is ripe for us to learn more about going forward.